Cry It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
Today's episode is one that gives voice to a moment so many in our community will never forget, the moment inside the ultrasound room when everything changes. For many, that room is filled with anticipation and hope. But for some of us, it becomes the place where they hear the words they never imagined or feel a silence that says everything before anything is ever spoken. What many don't realize is that behind the scenes and behind that screen is someone else holding that moment too. Today, we're joined by Natalie Avney, an ultrasound technologist and social media influencer who is using her platform to share a perspective that is rarely talked about. What it's like to witness pregnancy, loss, and life-changing diagnoses from the other side of the ultrasound. Natalie has cared for countless patients walking into that room with hope, fear, and everything in between. She's been present for joyful first heartbeats and for the devastating moments of miscarriage, stillbirth, pregnancy loss, and discovering that something may not be right with a pregnancy. In a role where there are strict boundaries around what they can and cannot do, Natalie carries not only the clinical responsibility of capturing images, but also the emotional weight of moments that stay with both patients and providers long after that scan even ends. Today, we're having an honest conversation about what sonographers see and what they feel, what they wish patients understood, and the unspoken reality of those hardest moments. Natalie, thank you so much for being here and for helping us to bring understanding, compassion, and a voice to a space that many have experienced but few truly see.
Thank you so much for having me.
Yes. Oh, and I just can't thank you enough for being on here. And I would love for you to share with our listeners who you are, your experiences, everything.
So I have been a sonographer for 13 years now in the OBGYN space, but I'm also a mom of 3 and a wife, and I share everything together. Like I kind of share, my daily life, but also a lot that happens here in the room. So most of my content is at work, a breakdown of what I see, humor, laughter, educational, real life, the sad stuff. And I think this is how we came across each other, that you probably came across one of my not so humorous and,
Yes.
just content that is real and raw and something that happens that we deal with that a lot don't see, because I feel like a lot of patients are here in those moments. They're like not here anymore. Everything turns dark. You don't even remember what the sonographer said. If she was nice, if she wasn't nice, you were just told the worst thing. And I'm just happy to be here to kind of show another perspective. And I know that I can't speak for everybody, just like in every career and every profession. Not everyone is going to be as compassionate, passionate, and nice, but it's a lot of times where we just can't be everything that we want to be in many scenarios, that I'm just happy to show the raw and realness here behind everything.
Oh, thank you, Natalie. Yeah. And that's what's really important, is really that rawness, realness, and what you're dealing with as well. You're walking alongside lost parents as their journey first begins most times
Right.
by getting, the news and things. Understanding that there is a person who's walking alongside you, there with you in that room
Right.
to do as well, to also protect yourself and everything too in those moments. Yeah. People often see ultrasounds as joyful moments, and I know we did until we fell on that bottom end of a statistic, right?
Right.
And, but you experience both joy and devastating loss, in your career and what you do. What is it really like to walk into a room where you don't know yet if you'll be delivering good news or life-changing news?
So I can tell you, I have goosebumps when I'm talking about this, because I remember when I first started. And even though I know of everything that could happen, you
Yeah.
don't realize how common it could be, right? So it's kind of like I remember starting every new OB scan with, "Oh my God, congratulations, have a seat. How are you doing? How are you feeling?" This, pitchy, like just exciting. And then seeing the fact of me needing to switch, and or just internally, like, like that
Yes.
pit, like that's just like, oh my God, like you get punched in the stomach, and it's like, oh my God, how am I switching my toe now? And it got a lot of, I want to say, a good year of getting used to how to navigate emotionally, because I always share this. It really depends where you work, but here in the office that I'm in, the providers, the midwives and the doctors that we work with, they want us to tell the patient here what's happening here. And I know it doesn't happen everywhere. A lot of times, even in the hospital when I worked, I wasn't allowed to say a word to the patient, like not even turn the screen. It was like policy of this is it. But here, because I do end up telling them, I have to do that switch of the high pitched voice excited to, oh my God. So then within the years, you learn to proceed with caution, right? Like a cautious excitement for the patient, not to be a Debbie Downer and not to scare a patient by my look of like, oh my God, why is she not excited yet? A lot of patients don't even know until it happens to them or to someone. Like I had my first pregnancy when I wasn't in the field. My son is almost 17. I was just chilling. I had no, like, not even a thought that I could miscarry ever. So I know that speaking, coming from that aspect of having a pregnancy outside of being in the field, I can tell you my other two pregnancies were horrible because I knew of every single, like, mentally, I was not in a good place like I was with my first. Because everything was rainbows and butterflies and I didn't think of anything. So knowing that some patients don't know of that is definitely something that you learn to navigate of, just to proceed with being smiley, but not like talking about the pregnancy and plans and is this the third, is this, you know what I mean? Like not talking and hyping it up yet until I see that flicker, until I see the normal anatomy, even though, I'm not doing an anatomy scan right now and we can't predict the future of the pregnancy at any point, and we all learn this unfortunately. But at that moment, I see that everything is good and I can hype it up a little bit and I can be more high pitch and excited. So that really took time to navigate, but it's definitely something that, yeah.
Absolutely. Oh, Natalie, you cut out.
I learned that through that process, I will have this cautious excitement. I'll be smiley and I'll be, just talking to the patient until I see that flicker. And that doesn't take a long time. I drop the probe, I see, and then I can be like, okay, I can talk about everything right now and just be excited. And of course, we can't predict the future of a pregnancy until the end. If it's just, there's anatomy scans to go through and a lot of things to go through. But at that moment, everything is fine. I want to be that light and I want to be that positivity to not make her think of the possibilities, to not that I don't want to be real, but it's just there's no need to deal with that right now. Everything looks good today and we can move on and until the next time.
Yes, and be in those moments, right? And right.
Yes.
And what's interesting when you were sharing about your two pregnancies after becoming an ultrasound technician and everything, it is almost like, and I'm not trying to compare or anything, but I
Right.
know with our pregnancies after loss, I completely was a whole different person in those pregnancies because I knew everything from knowing other lost parents, hearing other stories. Because
Right.
once you become the bottom end of that statistic, it can happen again. And
Oh,
so
yeah.
you now are fully aware of everything that can go wrong. And you're not almost in that naive bubble anymore of a pregnancy. And now so it approaches as a whole different thing. So you really do understand from your being in your profession and walking
Right.
alongside these losses, everything that can go wrong. So
Right.
you're also experiencing that with your pregnancies as well.
Right. And I also navigate a little differently with lost moms, especially when I'm the one who found the last one, right? And then I open the door to call my patient and I know what she's thinking. It's that girl that gave me the bad news last time. I know that it doesn't come, it's not personal. I just
Yeah.
know that it's like this, like that's the girl that told me last time. Or sometimes they'll mention, like, you told me about my loss last time. If you don't remember me, and I'm like, of course I remember you. And I navigate differently with just immediately. Like if there is an immediate, like I get my patients knowing that I have a heartbeat immediately, but if I can do it even faster, I'll do
Right.
it even faster for lost moms. Like I'm not wasting time. I'm just like, let's get the ball rolling so I can give you that confirmation so you can take a deep breath, right? And then just spending more time, even though, like, again, I am that person that does take their time, and that's why scanning time is so important, that I have enough time with my patients to be compassionate and not rush through it. And I feel like when there isn't that ability, sometimes that's also when patients think, oh my God, that ultrasound tech is so rushed. But it's the department that's rushing her. It's the policy in the office that's scheduling you every 10 to 15 minutes instead of giving you 30. It's there's a reason why a sonographer might be like rushing and maybe seem like stressed, because that could be the reality. She has to grab the next one that's, you know,
Yeah.
waiting for a while because she's behind. So there's a lot of things that come, again, I'm not defending rude sonographers because I feel like that exists everywhere in every
Yeah.
career. But
Yes.
just know that sometimes it looks like there's no personality because we're just go, go, go. But
Yeah.
with lost moms,
Yeah.
I'm there extra.
Oh.
I don't care.
Yes. Oh, Natalie. And that means the world, because you're walking alongside them and their losses and you're understanding too, which is huge, that you could be a potential trigger for them, right? Because they were in your room last time, they were with you. And for
It's
you to take that
awful.
level of care, yes, like you understand. And having that is huge.
Right. And
That's
when it is good news, I feel like I've corrected her experience, like I did good this time. Like I gave you good results, better, a better ultrasound experience in
yeah.
general. And yeah,
Because you get to walk alongside them then, right? And that
throughout the
too.
whole time. Yeah.
Yeah. And not just in that other, in their
Confirmation.
loss. Yeah.
Right. Right. Right.
Absolutely. And, that is so important to understand. Also sometimes, unfortunately, because sometimes you're giving more bad news in one day than good news. And so you need to compartmentalize as well. So you're not as emotional as the patients are and things like that,
Right.
and
Right. Right.
understanding that as well, because you're there from the very beginning with the
Exactly.
patients.
Exactly. It's so
Yeah.
important to like kind of decompress before grabbing the next one. And that's why, again, timing is so important for us, that we always continue to fight for it. And it's not
Yeah.
possible everywhere, because I just told someone the worst news. And I don't want to come in with that face for a person that's doing great today, and the other way around. Like sometimes I can go just fast paced because everything is like fine, 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 fine. And then wait, I have a loss. I need time. I need to deal with this right now. Like I'm not gonna let her go back to the waiting room. I'm gonna
Yes.
have her stay here in this room until the doctor can come and discuss. Because I'm not letting her sit in the waiting room with a bunch of pregnant, women that are out there right now and happy, happy,
Yes.
joy, joy, So
Exactly.
yeah,
Exactly, and recognizing that is huge because you're right, and that's something that, is talked about a lot in our support groups, is that they're put into a room even waiting, or depending
right,
on what's going on with them, and they're seeing all these joyful people holding their pictures, all of those things while they're sitting there not knowing if there's something wrong before they even get scanned, but knowing or feeling like something could be wrong, and
right,
then to get that news, it's all just it's a lot, and
right.
on top of what else you're navigating in pregnancy.
Right. And there needs to be a priority for these patients. I feel like there should be a priority. And yes, I can tell you here, I've been working for the same office for 13 years. I mean, different locations were the same people, the same providers.
Yes.
And I can tell you that there is a huge urgency. If she's about to see someone, if one of the midwives is about to see someone, but I'm dealing with the loss, that comes first.
Yeah.
And that has to be, we can't look at patients like, a number or robots, or it's not. It's just we have to deal with every case differently. And the same goes with the patient. Like I handle every single loss differently because you have to learn to read the patient. Not
Yes.
every patient wants a hug. Not every patient wants to talk a lot right now. Not a lot of patient wants to be, held or spoken. Like sometimes they just want to say, okay, there's no heartbeat. Okay. Like sometimes it's their third time. They don't want more of the mushy mushy. Like they're
Yeah.
already on a mission to get pregnant. That's not successful. Okay, just shush. Let me move on. Deal with this. And it's just different. And some
Yeah.
patients need that. It's their first time. They want to be hugged. They want to be held. They have nobody with them today. So I'm their support person all of a sudden.
Yes. Exactly, and especially during COVID, when there can only be
Yes.
one person in the room and it was you, the one getting
Yes.
scanned. Yep.
Yes. Or they're already moms and
Yeah.
their partners with the babies and they can't come, together like it is with the first. So
Yeah. Yeah.
and nobody thinks that something could happen. No, I'm just coming for an ultrasound. You're not
Exactly.
thinking that that could be something they might need support for.
Absolutely.
Yeah.
Now, Natalie, do you also, just talking through, sometimes the only thing we get are pictures or our medical records to say that validates that we were pregnant and, with a baby and things like that. Do you find in those moments that the people that would want that to remember this baby by still want the pictures, even if the baby has passed?
Same thing as far as like how they react. I feel like
Yes.
it's the same thing. Some do and some
Yeah.
don't.
Yeah.
Some ask me to turn the TV off.
Oh,
Some do want to see it. Some, for our new pregnancy, they don't want the TV on. That triggers them because they don't know what I'm going to see when I'm going to drop the probe.
yeah.
But I always give the option, and I
Oh,
make it seem like in a way of like it's normal if you don't want to see, because I don't want her to feel weird for not wanting to see. So
yes.
I'm like, totally up to you. Some do, some don't. Like I completely like, do you want these? Totally understand if you don't want them. I just wanted to give you the option. And if she's not sure, I'm like, I'm gonna keep them aside. If you ever want them reprinted, we can reprint it. Because sometimes patients leave angry. Like
Yes.
angry, like because why is this happening to me? What did I do wrong? Or that they can't think or make a decision, even as far as like grabbing the pictures. So
Absolutely.
you gotta just let them understand that it's normal, because the last thing you want them to do is go home and feel judged, like, oh crap, I was so mean to this person, or oh, I should have grabbed the pictures, now I look like a bad mom, or
Yeah.
just stuff, completely
Yes.
normal. There's
Right.
no way of grieving, there's no right or wrong way of handling this at all.
Absolutely.
So
But even having the option to be able to get your pictures later and
yeah.
educating them on that, because you're right, in those moments, well,
Right.
it feels like you're having an outer body experience, like you're looking down on yourself
100%.
almost. And like,
Yeah.
I remember I could not hear, I could not speak, I didn't know what to say or what, like, I was like, what is happening? And I swear people would talk to me like and say it different ways and a few people, and I still couldn't hear. And
Right.
like,
Right.
it was a lot to take on, but then
You
later
shut
to be
down.
able to go back. Yes, your body just goes like fight or flight, right? And like in those moments, but recognizing that if eventually you want these, but you don't need to have them, and
Right.
feeling that from the person who's doing it too, because that shame, blame, and guilt that we do, that game that like is played in our head from those immediate moments with like, what did I do wrong? How could I have prevented this? Like, what could I
Right.
have done more of?
Right.
And then you're right, like getting home, like sometimes we question things, we go and Google deep dives about it, but then to know like, oh, I can call them and get those pictures if I decide to, when I'm ready to go back into that office or ever,
Right.
or have them mailed to me. But even
Right.
understand that is huge. Just because, like I said, we don't get a lot of those memories or
Right.
recognition of our babies if we
Right.
want them.
Right.
Sometimes it's, some baby loss survivors really need to compartmentalize.
Right.
And one day they may want to compartmentalize, the other day they may not, but some of them we look at and they say, I look at this as a chemical pregnancy and that's what I'm calling it. I don't want to call it a baby. And it's like, that's where they're at. But then others, want the recognition. And so
Right.
it's really important, Natalie, that you're understanding that though, and that you walk
Yes.
alongside them in those moments.
Yes, because I've seen all of those things you listed.
Yes.
Some can just take it differently, and some don't want, and I think it really is a personality. Like
Yes.
I find myself as an overthinker. Like if I can have a situation right now, trust me, I will have 6 different analyzations for you of what this could be. But someone else, I have a friend, like it's just black and white.
Right.
And if God, I know that if God forbid she would ever have something like that, she would be able to rationalize it and make it as simple as possible for her,
Yeah.
right? So it's kind of
Yes.
like I want to think of that as like I can scan a blighted ovum. A blighted ovum, there's no baby in the sac yet. It's just the body. To simplify it, the body prepared itself for a pregnancy and created that sac, but nothing grew in it. I can have someone say, okay, cool, what can I do? Like, and I can have someone sobbing because they had the idea of them being pregnant. They
Yes.
have a pregnancy test that's positive. They are pregnant, but nothing developed further. It's a form of a miscarriage. It is a miscarriage. But
Yes.
some patients can look at it completely different. And that's why reading the room is important. If someone decides to simplify it, I'm game. I am not letting you think differently. I support your thought.
Yeah.
Go for it. You're going to see the doctor, and then, they're going to be able to handle and tell you how to treat it. If it's taking a pill, sometimes it does need a DNC. It just depends.
Yes.
But if that's your train of thought, I'm supporting you because I'm actually proud of you for being able to simplify it and to rationalize it, because I couldn't do it. And maybe that's why I'm so compassionate about this scenario, because I never had a miscarriage. I never had a loss, but my sister did, and a lot of my friends did. And I always talk about it, because even as their ultrasound tech, it was so hard to deal with it and to be the one to be like, I can't
Yeah.
see what I want to see.
Oh,
And to find the words to someone is whew. But
yeah. Because they don't
and
trust you. So they want you to do the scans, of course, because they want you to be a part of their journey and
yes,
in the ways we
yes.
can, Natalie. Oh,
And I'm happy to be there,
yeah.
because I'm happy that it was me that was able to be there as their support person at the same time too.
Yeah.
I'm not happy that this was the scenario.
Yeah.
I would love to have a different kind of outcome, but in a way, imagine them going somewhere else and then, oh, I wish it was Natalie who found it, or there's also a positive about that.
Yeah.
But yeah, some patients just take it differently, and I'm supportive about it no matter what,
Yeah.
because
Right. Well, and a lot of times you're meeting your ultrasound tech in the same breath, like you barely know them. You're not building a rapport yet until you're really like getting into the scanning. Then you're building
right,
more of a conversation.
right,
So really, unless they've scanned you before or you've known them, and they're like in your private clinic and things like that, it really
right,
is, with someone who is just an acquaintance. And
right.
and then depending on how, things happen and reactions and things like that, yeah, I think it would be better to be with someone that I know who is part of our support system and support
Right,
team,
right,
that we've had. But I think that's also too, you know, important if you can control it to have, your team of people who know you and
right,
including your ultrasound tech, and being able to request them or ones that are able to give you, like for me, I'm the type of person like I would need the news immediately if something was wrong. So I would want to go into an office knowing that that could be a possibility to
right,
be with somebody who can do that and
right.
is
And you can
experienced.
find that out. I mean, when you first have your initial appointment here, whatever it may be, you can ask the doctor, like, is there any way that the sonographer can give me the results, or if you can come in the room, I need it. And that's why I always like, from being a creator and reading comments, I see a lot of the things that happen. And a lot of people don't understand that they can ask for things. A
Yes.
lot of times we can't assume that this is what you need, right? So from coming from the professional, I'm telling all patients, it doesn't hurt to ask for whatever. Ask
Yes.
me for coffee. I don't care what it is, the randomest things.
Yes.
Ask me, because maybe it's an easy yes. Maybe by asking the doctor, do you mind being in the ultrasound room while they scan? Because I'm terrified of this happening again, or whatever it is. And if they can support you, and if you can't find that team where the ultrasound tech is going to give you the results there, and that's what you need, change your doctor. There are a lot of different doctors that it might not be what's familiar to you, but sometimes change is good. Sometimes you think you have the best team until you hear other people talking about other things that they're going through, and stories like, oh my God, my doctor did this, my midwife did this, and then you're like, wait, mine didn't. And I'm not here to bash or
Oh,
whatever, just to
no.
be that support person to tell you, if you're not getting what you need, change it.
Yes.
If you feel like you should, nobody can always guess what you need or what your needs are. It's like a love. I feel like patient care is also a relationship and a love language. I might scan someone who doesn't want to talk at all, and I
Yeah.
can just read it, and I'm
Yeah.
fine with that. And
Yeah.
sometimes I feel like, oh my God, I wish you could just like talk to make this more comfortable for you, just so I can talk with you. But that's not what they want. And they
Yeah.
want to just, so you kind of just have to find what, especially after a loss on your rainbow baby, to
Yeah.
make this the best experience, really. So
Absolutely. And educate to advocate for yourself, right? And like things that you
absolutely.
can say, not say, or ask for, but it is so important. Your life and your baby's life are in your doctor's hands.
Right.
And really, it was interesting. just after, our pregnancies after loss, and hearing from our doctors are like, listen, you hire us, right? You choose us to walk
Right.
alongside of you.
Right.
Like, we are part of your care team. Like, we care about you. Like, we honor this, journey that you selected us. And
Right.
think understanding, like, oh, we selected you, like, and you're going to walk alongside of us, and that you are our, like, our lives are in your hands. That
Right.
that is such an important decision to make in your life, because of something, and we experienced it, something goes completely wrong in delivery and things like that, that you have that team that you're like, I trust exactly what they're doing. They know our plans, they know exactly what we want, what we don't want, and they're ready to move on it, right? It's a whole
Right.
different thing.
Right. Right.
Yeah, Natalie. Oh, that's so important. But
Yes.
I just can't thank you enough, for explaining this, like what happens in the room, the level of care and compassion that you take with the patients, especially lost parents, and walking alongside of them, and also letting them lead. That is one of the biggest things we discuss with medical providers, is going off of the parents.
For sure. For sure. I feel like it also helps the providers, I feel, because there's no guessing games of what you look forward to, what you expect, what you prefer, not
Yeah,
prefer. Like it's helping everybody together. So definitely
yeah.
think it's all a collaborative work with everybody in the team.
So true.
Yeah.
If you could change one thing about how pregnancy loss and difficult diagnoses are handled in the ultrasound room, what would it be?
I would want that one rule where sonographers cannot always give results to change.
Yes.
I would want every office to be run in a way where I'm not saying I'm giving them a detailed report and dealing with what's going to happen next and what are the steps
Yeah.
of just
Yeah.
giving them reassurance or letting them know that something is wrong without the wondering, because online I see that a lot where patients are like, oh, my sonographer was so mean, she couldn't tell me anything. And the understanding of it really depends on the office policy. Some sonographers could lose their job if they say anything. Like in
Yeah.
a hospital, there's no way that I could have even showed the patient something. So if that one specific, coming from a sonographer, that one specific thing to be changed, where every doctor's office would be like, you know what, we have to establish a trust because it does come with experience.
Yeah.
So, where we maybe in the first couple months, we can see how that goes, but then giving them, as a sonographer, I can tell you we either see a heartbeat or we don't. And that's why, because I understand that, and that
Yeah.
it's not, I'm never going to call our job easy, but something as letting you know if I see a heartbeat or not, we are the ones who are going to tell the doctor right now that we don't see it or see it. So just giving us that ability, because
Yes.
I feel so fortunate that I have that my doctors allow that and my midwives allow it. And because I get to be that person for the patient and like an immediate support person immediately to let them know what's going on. And that's what I wish could change with dealing with that. Yeah.
Natalie, it's so true though, because it could be minutes or even 15, 20, 30 minutes until the doctor comes in from the time
Eternity.
you scan. Yes, which is like hours, right? And it just,
Yes.
like, it's grueling. They're sitting there spinning out, like, what is happening, what is going
Yeah.
on, especially if
Yeah.
there was silence, just like, oh, I'll be back. And then, like, for how
Oh my
long?
God, the I'll be back.
Yes.
Even
Ah,
sometimes, like when we need a second set of eyes on something to do with anatomy,
yes.
we do
Yes.
see abnormalities with fetuses all the time.
Yes.
And we establish a thing where, if something is a little more challenging, just to bring the other sonographer to. And I always,
Yes.
even that, I communicate. Everything's,
Mhm.
just letting you know, here's the heartbeat, here's this, just so they don't think that it's something to do with that. I
Yeah.
just need the sonographer to come and take a second look at these pictures, just so to make sure that I got the right picture. Now, I've been doing this for 13 years. The patients don't know this. And it's kind of reassuring where I'm not coming up as like, because maybe I'm just like an inexperienced tech and I just want someone to come and look at it. I'm
Yeah.
not giving it as oh, something's wrong. But
Yeah.
I feel like just even communicating that second that I'm leaving and coming back with another tech is like, what's happening.
Yes.
So communicating that is also important, that I
Yeah.
just need a second eye, because like you said, waiting, going and come back with the doctor is.
Yes, absolutely.
Yeah.
Oh, yes. If there's anything that you would like to leave our listeners with, I would love for you to share with them.
Yes. I just want everyone to know that we, as a whole, coming from the sonography community, um, we have so much love and so much compassion. And even if we can't show it sometimes, it's there. Sometimes a lot of sonographers are overworked and they don't even have, and it's sad that they don't even have the chance to be extra compassionate because they don't have the support at their workplace. And I want to direct it because it's not always, and again, not defending every sonographer. A personality is a personality. Some people are dry, some people don't have emotions, and they might be in the wrong field. Absolutely. But just know that majority of it to lead with, oh, that sonographer probably can't tell me anything because she'll lose her job, versus, oh, she's so mean, she can't even tell me what's going on. Like, just to understand that we're there for you, rooting for you, and like a lot of times we can't do much, but I don't I don't stop thinking about a lot of my patients with loss, and know that you're within our hearts. Like, we carry you for a while. I follow up. I want to see what ended up happening. If you ended up miscarrying on your own, or if you needed to do surgery, I follow up even though I can't pick up the phone and talk to you. I
Oh,
follow your journey, and I make sure that, just know that that's the case. So,
oh, Natalie. Thank you so much for
of
everything,
course.
for sharing everything today.
Of
This really
course.
has
Thank
meant so
you.
much to have you.
Thank you for having me.
Yes. To everyone listening who may be navigating infertility, recurrent pregnancy loss, miscarriage, stillbirth, infant loss, please know this: your story matters, your baby matters, and your grief matters. Healing doesn't follow a timeline. Trauma and loss don't have a schedule, and you deserve compassionate care through every step of this journey. At Chasing Rainbows, we provide free daily support services and a community for families impacted by these losses, because every loss matters. If this conversation resonated with you, please share this episode with someone who may need it. And if you are looking for support, want to volunteer, donate, or host an event, you can learn more at chasingrainbows.org. Thank you for being here, for listening, and continuing to break the silence around these traumatic losses. Until next time, this is Cried Out Loud. Thanks again, Natalie.
Thank you.